How can we harness the power of clinical data to ignite improvement in the healthcare industry? Our next guest, Greg Miller, is on a mission to transform the industry through innovative data solutions at Carta Healthcare. With nearly 4 decades of experience in healthcare technology, Greg brings a wealth of knowledge in leveraging data to improve outcomes and drive process improvement. While together, Greg shares how he and his team are tackling the challenges of clinical data abstraction, combining artificial intelligence with human expertise to deliver faster, more efficient, and higher quality results. Join us as Greg shares Carta Healthcare's groundbreaking approach to streamlining data collection for clinical registries, reducing costs, empowering healthcare providers with actionable insights, and paving the way for a data-driven future in healthcare. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Greg. So excited to have you back on the podcast today, and a big welcome, my friend.
Thanks for having me. It's always fun to talk to you, Mike.
Well, given your decades-long mission to transform healthcare by leveraging data to improve outcomes and how you're going about this with your current company, I'm honored to have you on the show for this important conversation. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Greg, it's almost time for our community to learn how you and the Carta Healthcare team are combining artificial intelligence technology with expert human abstractors to help your customers abstract data faster, more efficiently, at a lower cost, and all while delivering the highest quality data. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
I would say to look outside of healthcare. There's lots of cool and innovative things happening that are pragmatic and easy to apply, but they're not mainstream healthcare IT companies or technologies. So look outside of healthcare and see how you can apply those to the problem we have at hand.
It's so refreshing to hear that, Greg. I do appreciate it. It is amazing. You know, you can go outside of this industry. A lot of innovation happening, of course, happening outside of healthcare. We obviously have to start thinking differently. We've been trying to do the same sorts of things for the past number of decades. Obviously not working for us here in healthcare. We definitely need to start anew, think anew, go to new, maybe new vertical or other verticals for new ideas. I love this, Greg. And maybe you've been seeing this too. I've been noticing there are now more executives coming into healthcare that maybe historically or through their career weren't in healthcare in the first place. I'm rooting that on. I love it. I don't know about you, but I'm enjoying this kind of new breath of fresh air of new ideas, new people coming into our industry.
I'm 100% with you. I think we need fresh perspective, and not just fresh perspective, but fresh experience, right? The people have done things outside of healthcare that can be applied to our industry.
Absolutely. And of course, we're going to dive into that in just a moment. Some of the history lesson around Carta Healthcare, how it came to be in the first place, from maybe some of that new, fresh perspective and experience, if you will. Talk about everything happening today in your camp, Greg. I know we're going to have a lot to discuss on all the wonderful things Carta Healthcare is up to today. And then, of course, where you see things heading as well. We're going to get into all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Greg Miller, Vice President at Carta Healthcare. Greg, thank you so much for being back on the show. One of very few guests where we've had returned guests coming onto the podcast, sharing the story. Greg, always a pleasure to spend time with you, my friend. Lots to talk about today. Obviously, you've had decades upon decades of success, a storied career in healthcare. You have been there. You have seen it. You have bought the proverbial t-shirt, if you will. You have seen a lot through your career. And of course, now you are on to something big here at Carta Healthcare. Want to discuss how it all came to be. I know that there's some backstory there between you and some of the other executive team members. We'll talk about how that all came to be. Then we'll discuss who is Carta Healthcare, what you guys are solving today, the successes and the things that you're seeing in the marketplace today. Then, of course, we got to pull the crystal ball off the shelf and talk a bit about what you're seeing on the horizon for our industry and where things are heading, not only for the industry, but of course, for Carta Healthcare as well. Then can't have you leave until we ask you how we can be helping you as well. But before we get all into that, Greg, take us behind the scenes a bit, pull the veil back. How'd this all come to be? You've been going at it for decades on decades, storied career. How did Carta Healthcare come into focus and you joining the team?
Great question. So as you know, Mike, I've been doing this for almost 40 years, long time. And I have a fundamental belief that data is the single most important ingredient to improving healthcare. And so if I roll way back in my career to when I was graduated from college, started to work for Tufts New England Medical Center, where I was a management engineer with a clipboard, a stopwatch, and a pencil, doing time and motion studies, tracking every single supply used in the delivery of care. And the purpose of that, though, this is a long time ago, this is mid-'80s, and the purpose of that was to capture the data so that we could understand what the process of care was and therefore what the cost of care happens to be. And so I've spent probably, out of my long career, probably 35 years of my career in and around the data space. And way back when we developed a company called Transition Systems, or TSI, some people might remember it out there. We spun out of New England Medical Center and created the first decision support platform in healthcare. And that was a tremendous experience. So I've been steeped in the creation of data and the application of how to use data to drive improvement for a very long time. I also spent a number of years with Medicity back in the 2008 to 2013 era, and dealing with the HIE space and having to health systems think about data outside their four walls and how to exchange data for the betterment of care. And then, of course, I spent a number of years at Health Catalyst as well. Again, the theme there being data and using data to drive improvement. And so fast forward to, I should say the underlying theme of most of those experiences is TSI, Medicity, Health Catalyst, and now Carta Healthcare. The common element in there is Brent Dover. Brent is the CEO of Carta Healthcare, and he was the president of Health Catalyst and the CEO of Medicity. And way back when, he was on my sales team at TSI. So I would say I've been following Brent around for a long time for the simple reason that he's an incredible leader and an incredible human being. And we just do great work together. So that's how I got to Carta Healthcare.
So let's now dive into, and it's amazing to see teams like that are banded together for organization after organization. That speaks volumes about everyone involved, because as well as I do, I come from a background of playing high-level college football and know the power of what teams can do. So I love that backstory. Always important for our audience to hear that. But of course, Greg, we also got to discuss, how did Carta Healthcare come to be in the first place? I know there's an interesting story in there. Maybe we'll talk about kind of the founding origins of Carta Healthcare, and then we'll get into kind of current state of who the organization is.
So your alma mater is Stanford, and Carta Healthcare actually began at Stanford, essentially back in 2016. Matt Hollingsworth, who was our founder, was an MBA candidate at Stanford Business School, and he was also a data scientist. Now I have a data science background, and he was working on a project with Stanford Children's Hospital. And the project was focused on trying to understand supply utilization in the OR. And they were trying to streamline operations and reduce the cost of care. And what they essentially, in trying to understand this, it was not too dissimilar to how I started my career way back when, which was manually gathering data and in tracking every single supply and how it was used and the people that were involved and so on and so forth. And so the problem with that, though, that Matt had in trying to gather this data is that it took 18 months to gather the data. And you know what happens at the end of 18 months? One, you forgot the question you were trying to answer. And the second is the data is outdated and it's stale. And so he, having a data science background, he wrote an algorithm to automatically abstract the data from the source systems for the benefit of this specific project. And the principal investigator that was on the project saw what Matt had done and saw that there were more applicable uses for what he had developed than just the supply project. And one of the key areas that they focused on was on clinical data abstraction for the development of registries. Now, a lot of people know what registries are. Well, some people know what registries are, some people don't. But clinical registries are really important data sets for the improvement of healthcare. And some registries are mandatory, like through CMS and so on. And then a lot of the clinical management bodies out there, like the American College of Cardiology or the Society of Thoracic Surgeons or what have you, they have registries specific to that specialty and even specific to individual procedures. And so this data is really important to gather for the benefit of improvement of care for patients. The challenge with abstracting clinical data is that it is manual in its nature today. It is time consuming. It's really expensive because it is dependent upon labor, and people are prone to human error. And so it doesn't always produce the highest quality data. And in order to really drive improvement, you need the highest quality data as fast as you can get it, and doing it at a much lower cost than it is today. And that's really what Carta Healthcare is all about.
Well, got to love a shout out to my alma mater. I love when the smart folks like a Matt see a need, develop it, and now here you are a number of years later with a full-blown company. Absolutely incredible story. Thanks for sharing that, and thanks for setting the stage there, Greg. So let's get after it. Let's get right into it. Let's hear that elevator pitch. Who is Carta Healthcare?
Well, so in the healthcare industry, providers spend between $10 and $15 billion a year manually abstracting data for clinical registries. So you have this body of data that is really important, really necessary, but it's just an arduous process and costly process to get that data. And so what we're really focused on is how can we apply, going back to the original project that Matt had, how can we apply artificial intelligence to this challenge while also keeping a human in the loop to validate the quality of data is there. And in today's world, and if I back up a little bit, Mike, think about the evolution of technology. While Carta Healthcare has always had data science and AI capabilities that we've been applying to this challenge, it wasn't really until about a year ago that large language models became really commercially viable for a company like Carta Healthcare to take advantage of. And so I would tend to describe a lot of the projects that we had with early customers were a little bit bespoke, I guess, sort of independent data science projects. And going back a year now, we started testing, leveraging LLMs to the problem. And so when you think about what happens in the process of data abstraction, we tend to refer to it as swivel chair interoperability. And let me explain what that means. So quite literally, a data abstractor, and people doing data abstraction are usually nurses, PAs, NPs, and even physicians that are doing the data abstraction work. And they're on this screen over here, right? They have the EHR de short, right? Call it Epic, Cerner, Meditech, or what have you, and other departmental systems. And then they're over here on this screen, they have the registry bodies system that is built, has a user interface from like 1995. I'm being a little facetious there, but it's not too far away from if you've seen these screens. And a number of hospitals out there are still recording it on paper today. And these registries have a series of questions that could be 50 questions to 500 questions, depending upon the very specific registries. So what happens is you have an abstractor that's looking at this screen with the EHR, and 80% of the data, as we know, in an EHR is unstructured notes. Well, the unstructured notes is where the data is that is needed for the data abstraction. And we know that there's no standard for the unstructured notes that physicians and other clinicians document about the patient. So they're literally reading through all these notes all day long, turning to this screen over here, entering the data or writing it down on a paper form. And this happens all day, every day, in virtually every hospital across the country. And I should also mention that one of the reasons that registries are important is not only just for quality and process improvement, but as I mentioned, there's regulatory compliance issues, there's accreditation, as well as they want to be able to prove to their community and their constituents that they have high quality care. And so these registries are critically important. So if you can imagine, going back to what I was mentioning about being able to apply LLMs to the challenge of clinical data abstraction, it's a marriage made in heaven because it's using language, right? It's going after that text data and can pull out the salient points. What's also, I think, what we found is, and so let me actually add to that a little bit. When we started using or applying LLMs, we were hopeful that we'd get maybe 50% of the way there, that the AI could answer 50% of the questions in that registry. And then we always have a human in the loop, an expert abstractor to validate that the answers are correct, right? We are seeing now in customer deployments that the AI is completing accurately 85 to 86% of the questions. And we believe it's just going to get better and better and better. But we still want that human in the loop because we all know that AI makes mistakes. Now, is it going to get better over time? Absolutely. But AI does make mistakes. And that's why we want the human abstractor in the loop to validate. At the same time, the registry bodies don't want you to auto-populate the registry. They actually want that human to validate and populate that data. And so we've seen just an amazing throughput and the cost of abstraction, be decreased by 80% or more in the time, right? And when you think about it, when I'm talking about the swivel chair interoperability, on average, depending upon the registry, it takes a person doing the abstraction work about an hour per case. Whereas you apply AI to the problem and we can process thousands of cases in minutes, right? So it's a massive throughput improvement as well as data quality. And so there's an important metric in the world of abstraction and registries. It's called the inter-rater reliability. And essentially what that means is if you have two abstractors abstracting the same case, what percentage of the time are they coming up with the same answer? And so most hospitals, it's considered, if you have an IRR, inter-rater reliability, it's a mouthful. It is about 90%. So if you have a 90% score, it's considered good. We are consistently at 98 to 99% IRR with our customers. And so it's kind of a trifecta, right? Reduce the cost, improve the quality of the data, and do it a whole lot faster. And we're just really on the tip of the iceberg of, I guess, launching this out in the market in a big way to help health systems everywhere because, again, a lot of these registries are mandatory. And so for compliance reasons and so on. So they need to do the work and we want them to do the work. And so we're applying technology in a very pragmatic way to a age-old problem in healthcare.
That is unbelievable. And you're absolutely spot on, Greg. It's the advent of large language models or layperson's world. When ChatGPT took the world literally by storm, that is exactly that for the folks tuning in. That's exactly what those are, large language models. And now obviously coming into healthcare in big, big ways. Greg, unbelievably and profound results, but actually I'm not that surprised given where we have the acceleration of artificial intelligence and these models, et cetera, over the past 18 months. It has been one of the biggest transformative moments from my perspective in healthcare technology that I've seen in my career. And I'm sure you're seeing that as well. Greg, let's also talk about those end users. You talk about data extraction faster, more reliable, cheaper. What does this look like? And what are you hearing from those end users as well? Those health system executives, the folks that are on the hook for these mandates. What's the end feedback? Because you know as well as I do, we can sit here all day long and talk about our technology and it's the best thing since sliced bread. But at the end of the day, it's those end users and their feedback. What has it been like out in the marketplace?
Yeah. So let me just preface this by saying, and this is the Greg Miller personal opinion view of the world. In my mind, there are two camps out there relative to AI, right? There's those that are deathly afraid of it. It's going to take jobs. It's going to kill patients. They're jumping right to the most extreme use case of replacing a doctor and all that sort of stuff. So there's a lot of fear around the application of AI. There's also a second camp that I see out there. And the second camp is the FOMO crowd, right? They know it's here. They see it. They can use it on their phone or on their laptop. They use ChatGPT or whatever. And they know they should be thinking about it. They know they should do something with it, but maybe they're not exactly sure how or what yet. And so we find ourselves talking to health systems everywhere that even within the same health system, there are both camps, right? And so, you asked me at the opening of like any piece of advice I would have. Again, I would say, look outside of healthcare to how these technologies are being applied in a very pragmatic way, in a safe way to improve care. So one of the challenges that we've run into, quite honestly, is that health systems have their extraction team in place. These people work really hard. It's a hard job. And they like their team and they don't want technology to replace their team. And so I think there's a different way to think about it, though. And the way to think about it is the RNs, the PAs, or the NPs, or the docs that you have doing the abstraction work. Think about how much of their time could be used for taking care of patients. And we all know, it's not to beat a dead horse on this, but we all know there's a massive labor shortage in healthcare. It's not going to get better anytime soon. And so really being able to apply technologies in a pragmatic way to free up clinicians to do what they're actually trained to do and what they love to do. Now, there is a certain populace of people out there that do abstraction that's all they do and that's all they want to do. They have a clinical background. They maybe don't want to be on the front lines of patient care delivery anymore. Great. Well, you just don't need 1,000 of them. Maybe you only need X of them to do that. And honestly, when you look at certain registries, for example, in oncology, the CDC requires data to be submitted on cancer patients. Every state has their own cancer registry that they have mandatory to submit data to. And so you have to work on this. The challenge is, though, that the people to do oncology data abstraction have to be a certified oncology data specialist, or what's called an ODS. They're really hard to find. And so leveraging technology to apply to oncology, as an example, is a huge boon to the industry because there just are not enough of them around to actually do the work.
Well, I'm in the second camp for sure, Greg. I think you already know that about me. But what I love about this topic is a fascinating one. We're talking about workforce shortage. It's not letting up. If anything, it's only going to continue to get worse. We have a absolute crisis in front of us around that. And then also to your point, right? There are some folks that they want to be data abstractors day in and day out. They don't want to be on the front lines. That's great. And then also to your point, yes, there may be some clinicians that, hey, let's get them back on the front lines. Let's get them back to what they trained for in the first place, is to deliver that care. But even with both camps, Greg, I would love your thoughts on this in regards to leveraging technology and putting it in their hands like a Carta Healthcare. Now, all of a sudden, yes, you can have those clinicians working at their top of scope, getting back to what they originally trained for, that deliverance of care, if you will. But they, as well as the folks that want to just continue to stay as data abstractors, we're now freeing them from some of that mundane work to allow for the machines to do that. So then their creativity can be applied to the work at hand.
Absolutely.
Would you agree to that? And what does that look like to open up an even more prolific world as technologies like Carta Healthcare are giving these workers, very important ones, almost superhuman powers?
So, like, you bring up a really good point, because one of the things we hear from health systems is that the people doing the abstraction work love their job. And as I dug into it and started thinking about what is the real problem and what are they really doing every day, it paused me to stop and say, really? Do they really love their job when you look at the work to be done? And so we did a market research study with Reaction Data recently. And we asked the people doing the work, we asked them a series of questions about how much they like their job, basically. And 60% of the people surveyed responded by saying, when asked how much they love their job doing data abstraction, 60% said they were either neutral, negative, or very negative. So I think the data kind of shows that people are looking for help, and there's an answer. We also, in the same survey, 58% of those that responded said that more than half of their work is manual in nature. And so there's a clear problem to be solved here. Now, on the flip side of that, Mike, what I would say is, after I did that survey and saw what the reality is and how people doing the work actually feel, it caused me to ask a second question, which was, okay, health systems going through all this effort, spending $10 to $15 billion a year doing the manual data abstraction. Is anybody using the data? And if they're using the data, how are they using it? And so I was actually really delighted to see the results of that survey, in that 75% said that they are using the data for quality and process improvement, which is the intended outcome, right? And there was some other reasons for using it, like compliance and so on, but using it for quality and process improvement is huge. And then when I also looked at the type of people that are using the data for quality and process improvement, it was 50% was physicians. So I was very encouraged by that. One of the challenges with the registry data, though, is that all the hospitals that are participating in a specific registry submit their data to a registry body, okay? And They then have access to the data and comparative reporting and things like that. But what happens is many health systems don't have the resources to do the data abstraction. So they could be 1, 2, 4 quarters behind. And so the health system has to wait until there's a certain volume of data submitted to the registry body to then get the analytics back. So again, you have this time delay on essentially having the data to be able to make decisions for quality and process improvement purposes. So that's one of the things that we aim to also help improve is the speed, not only the time, the speed, the accuracy of the data, but getting the data in the hands of clinicians as fast as possible to be able to drive improvement in healthcare.
Well, that is a very exciting current state. I know you guys are delivering exactly on that mission, Greg. But of course, we definitely need to take the crystal ball off the shelf, talk a little future state as well. This world is moving fast. We just talked about it a couple minutes ago with the explosion of large language models into our own personal and professional lives. I know things are going to continue to accelerate as we look a little bit more forward thinking. What's it looking like for you in regards to the organization and the market kind of writ large? What are you seeing over the next 2 to 3 to 5 years? What should we be mindful of?
So let me give you the sort of near term horizon as we think about it. One is applying the AI technology to as many registries as possible. We participate in about 20 to 25 different registries today. There are new ones that evolve and other ones that we want to participate in as well. So we're going to continue on our march to help health systems adopt this technology for this specific purpose of data abstraction. But getting back to my sort of data roots, right? We're helping these customers accumulate data very quickly. And again, we want to get it into their hands to make improvements as fast as possible. And so whether we develop our own analytic offering or integrate with other analytic offerings like Health Catalyst or Google or anybody else or Innovacer, Arcadia, any of the analytic platforms that are out there, that's a question we get from our customers all the time is, can we populate their data warehouse or what have you? And so right now in the next probably 24 months, that's our focus, is getting to as many registries and getting the data into the hands of users to activate the data is on the horizon. I think the core of what we do, applying LLMs to structured and unstructured data, can be applied to lots of other things. And so we're going to be testing a bunch of new things, and we're going to have some pretty exciting announcements coming up in the next few weeks that I can't tell you about now, but if I see it at Health, I can tell you about.
Well, don't get too ahead of yourself. You might sign up for a 3rd episode. You would be the very first guest in the history of this podcast for 3 interviews.
Trifecta, right? Somebody has to do it. No, but seriously, we're going to be looking at where else in healthcare can we take the core of what we've developed and apply it to the problem of structured and unstructured data and how to make sense of all that.
I may have joked a little bit about that 3rd episode, but I actually might be pretty darn serious because my brain is already running a million miles an hour of where you can apply this all over the place in healthcare and the supporting industries. I don't know, maybe that one little industry called pharma. I mean, I don't know. There's just a lot of places where this could easily be applied.
Absolutely. I mean, if you think about it, just take clinical trials. We all know that finding patients for clinical trials is a real challenge. And the cost that a pharma company or a biotech company goes through to recruit, find patients, recruit them, and more importantly, get them to stay in the trial is the bulk of the R&D cost. And so when you look at the challenge of clinical trials, it's a similar challenge to data abstraction. There's a corpus of data. I need to be able to comb through that data to identify who the patients are to match them to this clinical trial. And then we need to engage that patient and so on. That's just a simple example that's not in our wheelhouse today, but we could apply the technology to that problem as well.
Well, a very, very exciting future, even near term and long term. Greg, we'll put the crystal ball back on the shelf for now. We'll get back to current state. What's one problem, need, or question that our community can be helping you and the Carta Healthcare team with?
I think I'm a very naturally curious person. So I'm always interested in any innovations or developments that can help our cause and more importantly, help health systems improve patient care. And so if anybody's out there in the universe and has great ideas on how we can apply technology to the data abstraction problem or otherwise, I am personally all ears to hear, innovations that are out there. So I'm bullish, Mike. I'm really bullish on the future of technology in healthcare. I'm really excited about it. And I can't wait to get going, and I'm going every day.
I love it. Yeah, you're just getting going, Greg. I tell you what, it is an exciting time on the horizon for us. I know for folks like you and I have been at it for quite some time. The opportunity ahead is just so exciting, and it's so humbling, to be honest with you, to be a part of it. So very good stuff. Well, for those folks that want to get involved, and I know you are sincere in what you say, you definitely want to hear from those folks. How do they get a hold of you, Greg? Social media handles, websites, or otherwise? How do they find you online?
You can find Carta Healthcare on LinkedIn. That's easy to find. And our website is Carta, C-A-R-T-A, carta.healthcare. It's not cartahealthcare.com. So that's just tricks people up sometimes. My email address is gregm@carta.healthcare. So you can reach out to me there. You can find me on LinkedIn very easily. So yeah, reach out. We'd love to hear from people.
Easy enough. And for our listening community, in your favorite podcast player that you're listening to this episode to, just scroll on down into the episode notes. You'll find all those contact points for Greg and the Carta Healthcare team. Of course, you can always head over to our free global online community at passionatepioneers.com. There will be a post for Greg's episode where you can leave comments, feedback, suggestions, or otherwise, and get those contact points for Greg and the team. Again, over at passionatepioneers.com. Greg, let's wind it down. Like I said, I'm just saying we may have signed up for a third episode. Exciting for sure. But before we let you out of number 2 for you, got to fill in the blank before we get you out of here. I'm a passionate pioneer because
it is a moral imperative to improve healthcare in the United States of America. And when I say improve, I mean bring down the costs, improve quality, improve safety. It's just a moral imperative. I think, Mike, about my kids are in their 20s and they've started their professional career. I worry a lot about what the world's going to look like for them when they're my age. And I just believe that we have this moral imperative to drive improvement.
Well said, my friend. Could not agree with you more. And as always, an absolute honor, a joy, and a privilege to spend time with you, Greg. Thanks for coming back onto the podcast and being with our community and taking time out of your very busy day to share all the wonderful things happening in the Carta Healthcare camp. Again, Greg, thank you for being with us today.
Thanks for having me. It really is a pleasure getting together with you, Mike. I just love the sort of fireside chat conversation. So thank you.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.